Services and Aging Committee meeting is now called to order. Chrissy, would you please call the roll?
Calling the roll, Mr. Jones,
Here.
Ms. Conwell,
Here.
Ms. Brown. Ms. Brown is absent. Mr. Schron. Mr. Schron is absent. Mr. Miller. Here. We have a quorum.
Thank you. Has anyone signed in for public comment?
No, Mr. Chair, no one has signed in.
All right. Can we have a motion for approval of our minutes from the June 17th meeting?
Also moved. Second.
Moved by Councilman Miller, seconded by Councilwoman Conwell. All in favor say aye.
Aye.
Aye, the minutes are approved. Well, we have one item on our agenda today, a resolution dealing with our El Barrio Incorporated for job readiness. Chrissy, if you would please read this resolution into the record.
Resolution 2015-0121, a resolution authorizing an amendment to contract number CE 1200421 with El Barrio Incorporated for job readiness, job search, job placement, and job retention services for Ohio Works First Cash Assistance and food stamp recipients for the period 7/1/2012 through 6/30/2015, to extend the time period to 12/31/2015, and for additional funds in the amount not to exceed $632,429, authorizing the county executive to execute the amendment and all other documents consistent with this resolution, and declaring the necessity that this resolution become immediately effective.
All right, Director Merriman, if you would like to speak to this item.
Good afternoon, David Merriman, CUG Job and Family Services. I'm here on behalf of the executive with a contract amendment for El Barrio. And El Barrio is a provider that we procured several years ago to provide job search, job readiness, and job placement supported services for our clients receiving cash assistance. In the write-up you see it references Ohio Works First Cash Assistance. El Barrio also supports recipients of food assistance and is a well-established provider in this community. It services referrals from us and links benefit recipients to both training as well as placement into employment. We've requested this as a 6-month extension as a measure for us to take time to see how the governor's budget progressed and his proposal for the implementation of comprehensive case management. Our thought was that before we extended contracts for a year and established or essentially reestablished our service model, we wanted to see what the impact of the governor's proposals would be as it worked its way through the legislature. And so this is just a 6-month extension. We would be grateful for consideration of passage in 2 readings. And I'll ask Bob Math to come up and present with me if you have questions about this specific program. But I'd be happy to share, over a several year period, this program has served 900 people or close to it. And it accepts referrals from us. It provides this ongoing program, and then it places individuals into jobs and then tracks them for a period. And a part of their payment is actually based upon whether or not those individuals stay employed. I'd also be happy just to share that the governor's proposal did go through, and so there is a new program that will be established in Ohio called Comprehensive Case Management and Employment Programming. The initial proposal was that program would begin in December of 2015, so at the end of this year. And it would, I think the expectation is it would be up and running at that time, and it would initially focus on youth 16 to 24-year-olds, and then in July of 2016 it would be extended to everyone. Through the legislative process, that proposal was amended, and in fact the program will start, but it won't start until, I'm sorry if I'm not clear, it's either May or July of 2016, and it will just be youth. So the point of that is to share our request to have this contract extended for 6 months and to continue to use this provider was really tracking the possibility that a whole new service model could be coming to us through the governor's office, and that we would be required to rapidly change our service model in response to that. So we were really just looking to buy ourselves some time, understand the new program, if necessary, do an additional procurement, identify new providers, or make other structural changes. There's also a chance that there could have been some shifting of funding. So we didn't want to make too long of a commitment to any single provider. A last thing that I would say about this, and then I'd be open to answering any questions you have. In the past, we had multiple providers do this service. Due to a decrease in the number of individuals receiving cash assistance in Cuyahoga County, we now feel we can use just one provider for this program. And so you'll see that this is just El Barrio, and we feel like they can handle the total volume for the entire community. And that's both for cash assistance recipients as well as food assistance recipients. So be able to stop there and see if you have questions that we can address, and if we can provide you any other information on this request.
Dave, back to the state. Their model goes into place in December. Is that correct?
No, so that was the initial proposal, that the model would go into place in December. The legislative process changed the timeline, and so their model won't go into effect until, I'm sorry, it's either May or July of next year. So we have close to a year to do the planning necessary for the new model.
So you don't need a further extension after that, you think, between now and December?
Yeah,
Even though they don't go in place until April?
It's not clear yet. We're actually talking with the state. I had a call with them yesterday. We're talking to them today. I'm talking to them later in the week. And so we are trying to get a better sense of what their timeline will be and what the expectations will be. So there is the possibility we may want to extend this for an additional 6 months. But it's too early to tell. And if we do get guidance from the state that they want us to use a procurement to implement that new model, then it would be better for us to just issue that procurement later in the year and start it earlier if necessary than doing multiple procurements and changes of contracts and rerouting of clients.
Now, this comprehensive case management, this is for ages 16 to 24?
It is.
But the contract before us, this is strictly for adults, is that correct?
Well, that's correct. So there's the comprehensive case management program will ultimately serve clients from both the job and family service system, so both cash recipients as well as food recipients, as well as clients coming out of Ohio Means Jobs Cleveland-Cuyahoga County's office or workforce development. So the new comprehensive case management program is intended to serve clients from both systems. That system has a heavy focus on youth, and it works out to our advantage. Most of our clients are actually in the youth population anyway. The way that welfare reform has occurred, most older adults with children have exhausted their time that they can receive benefits. And so most new clients coming into the system are in fact young people less than 24. So 24 is actually considered youth in most federal programs.
But this contract with El Barrio is serving the same age range?
It's serving everyone. Everyone can be served out of this contract with El Barrio. I just, again, would just recognize most of our clients are young because they're young parents.
Okay, let me open it up to questions. Councilwoman?
Through the chair to Mr. Merriman, was there ever any consideration, you talk about it, since it's been moved back to May, why just extend the period for 6 months instead of just extending the time period all the way from now to the start of May?
There was that consideration. We had a lot of discussion about it, and I think we could have gone in both ways. It actually wasn't clear that pushback was going to occur until several weeks ago, pretty midpoint in June, late into June. The initial proposal was for the new program to start in December of this year. I think now that we have the new timeline and the additional months to prepare for the new program, we could extend this for 12 months. But I'd still like to hear a little bit of more information from the state as to what their expectations will be for us. So if the state would like us to do a procurement right now to identify new providers, then we may want to start that and begin to pilot it on our own or ramp it up on our own before the state system goes live. So this gives us a little bit of flexibility. We're not committing to our business as usual model for a full year. We're committing to 6 months, and then we'll reassess during that time and see if we should have another 6 months or whether we should maybe just look to start the new system.
But it wouldn't be a full year.
It's not actually yeah. So.
Because I'm just thinking about the time, the efficiency, the time it takes to write contracts and all that, and what it does for the organization that is, basically, I guess, going in with us on the 6 months.
Yeah.
Not to give them, that initial time. I mean, I don't see the issue with just amending it to that time frame. But if you guys talked about it, I'm sure you know.
Councilman, you're right. I mean, I think definitely on both sides, on the center's side, El Barrio's side, as well as on our side, there are a lot of work goes into doing a contract amendment, and whether it's for a year or it's 6 months, you put in that work, and if you have to do it a second time, there is more work. The time that we considered this contract, we were still tracking that the new program was expected to start in December of this year. So we thought we were being prudent by just making a commitment through this year, while we waited to see what was going to come from the state. When we got essentially indication that the state was going to push its timeline out, we'd already set this amendment up, and we had this in place. So in essence, the legislature changed the governor's proposal. The governor seemed to support that in the new timeline, but our contract work had already begun.
So if the legislator is not ready to roll out their model in May, what will that do for us?
Well, and it's still the governor's proposal, and it's the governor's program. They've just changed the model. What's the law? So I'm not sure not being ready doesn't stop us from moving forward unless they amend the law. So I think we have to be planning and be in a position to start this new program next year. And so that's the reason we've asked for, at least this time right now, to continue to work with the state, to hear what their goals are for that program, and to be discussing, do we need to do a procurement? Do we need to retrain staff? We need a lot more details from the state before we have a clear sense of how to implement their vision. But as I've said, we're talking to them almost every day to get that additional information.
Because this is good to about December, but when we hit that January mark, if we haven't heard anything from them, like you said, we have to start planning and
That's right.
and doing things.
And we may need to do another amendment. I'd prefer not to do 2 amendments, but if it doesn't seem like we have a firm grasp, or if the state hasn't solidified its model, then we'll have to take that into consideration.
Mr. Chair, can I ask that Dave come back to us, this committee, in January and let us know where the state is?
Absolutely.
Give us some update. Thanks.
Absolutely.
Councilman Miller? And let the record reflect Councilwoman Chantel Brown is in attendance.
Mr. Chairman, Mr. Merriman, could you explain what the strategy is that El Barrio uses in helping to prepare people for employment and place them?
I'm going to ask Bob Math to join me, because he knows the program much better than I do, because he's worked with it for years. But if I can set him up by saying, our staff, the staff within our job education and training program, sit down with the client and they present them a series of options. Do you want to do the work experience program, where you go and you get professional experience that's not paid for? You're placed within an organization, and you can do that to meet your requirements. If you're in school, at certain school programmings, that can meet your requirements. Or do you want to do this job search, job placement program? And so for clients that choose that they want to do job search, job placement, our staff refer them to El Barrio. And at this point, let me turn the mic over to Bob Math to let him explain to you what goes on with when El Barrio sits down with the client.
Through the chair, Councilman Miller. The program is, in some respects, it's a sort of a traditional job search, job readiness program. They teach our folks kind of those soft skills that are required for the job. The folks that have come to the program are folks that have been identified already as being somewhat job ready and motivated to work. So they already have some skills. They've already had some attachment to the labor force. So these are folks that are the folks that are being referred are folks that we think, and are based upon our assessment, are ready to take that next step and move into kind of a fast-track job placement program. What's unique about El Barrio is that they run a couple different tracks. So if somebody comes in and they've already had a previous attachment to the labor force and they think their skills are very remarkable, they move immediately into kind of a job search phase. El Barrio has developed relationships with countless employers, over the years that, come to their site and interview candidates on site and do presentations. So they've had a very successful track record of placing our folks. For folks that come in that are motivated but don't have quite the marketable skills, they do have a short-term kind of like a hospitality customer service type program, because we know for a lot of our customers that kind of entry-level position is kind of the first opportunity for them to enter the labor force. So they do this, it's a 4-week kind of curriculum that includes some specific skills related to customer service, as well as those kind of soft skills in preparing for interviews and so on and so forth. So they've enjoyed, they've been one of our partners since the beginning of welfare reform, if you will. So they've done a very credible job in terms of placing individuals. They've always achieved our benchmarks. And as Mr. Merriman indicated, these contracts are performance-based, So they only realize the full value of the contract if they're successfully placing the participants and achieving their benchmarks. So that, it's a very motivated type contract, So they aggressively work with the individuals, and part of that contract is job retention as well. And right now we track folks up to 90 days, and that's the largest payment point of the contract for those people that remain on the job for 90 days.
Bob, if I can interrupt you just for a moment, did you say that you give them some hard skill, the ones in the, did you say culinary or?
No, Mr. Chairman, it's in the customer service hospitality industry.
Hospitality. But it is somewhat of a hard skill.
Yes, it is.
Okay.
To what extent do they assist people with personal issues, self-concept, mental health issues, drug or alcohol abuse, things like that may be impediments to employment?
Councilman Miller, part of the contract is to provide this comprehensive range of services. So Barrio is part of the Center for Family and Children when they merged several years ago. So they have access to a full range of the services that the Centers for Family and Children, have in place, which includes, mental health services, substance abuse issues. They work with, single fathers. They work with building self-esteem. So they have some subcontracts with partners that come in and do presentations. So one of the reasons that they are successful is they do provide this what we so-call wide range of supportive service. So they access, if it's services they don't have in-house, they access them throughout the community.
Okay, and my other question is, what do we know at this point as to what the strategy is on the state program and how it would differ from what's currently being done?
So the state program was actually conceived out of a work group that I was a part of, where they brought together directors of job and family services from around the state with an effort to identify strategies to reduce dependence on public assistance. And it was out of that work group that we actually, my peers and I, created some recommendations that we should start with young people. That's one of the best times to start, because they may still have access to school time. They may have other resources available to them. They're also somewhat open to learning. And the other thought that we thought was important was that it should be comprehensive, and that we should not think in terms of silos or just our program or just our services. And so the state took these ideas, to be honest, they took the ideas before they were fully formed, and created this proposal and the comprehensive case management and employment program. And the general concept is that anybody receiving public assistance, cash or food assistance, will be assessed. And at the start, the individuals that are young, 16 to 24-year-olds, receiving cash assistance will be directed into a program where if they just have a few barriers to employment, they will receive kind of a lighter touch, quicker engagement and referral to employment. And that will largely come through workforce development, or you'll excuse all the acronyms, the Ohio Means Jobs Cleveland-Cuyahoga County office. So that's right there on Boulevard. And so those are the low-touch individuals, if you will. Individuals with multiple barriers to employment will receive a more intensive form of case management that will help them work through, I think, some of the questions you were asking about, Councilman Miller, in terms of are there psychological barriers? Is there substance abuse? Is there other elements of their life that are preventing them from being marketable to an employer? And so that's really what the focus is right now, in trying to understand what that comprehensive, intensive portion of the services will look like, what the expectations will be, what resources will be available. And we don't have an answer to those questions yet from the state, but we're still working with them, I think, to define the program.
Well, Mr. Chairman, Mr. Merriman, given that set of information, the short-term contract does seem to make sense, that we would just basically continue what we're doing for a short time and keep our eyes on what kind of adjustments we might need to make to align ourselves with what the state is doing.
I would like to connect that this decision also relates to a decision we brought an item to the Board of Control recently to extend our contract with the Workforce Development and the Ohio Mean Job Center to continue to provide some of their services. So this is something we've been doing across the board, and we've extended multiple contracts for this purpose. One last point that I think I left out. So as Bob Math referenced, El Barrio is a part of the network of providers within the centers. This is good, I think, for the community because this will enable clients to be served on both the east side and the west side. So there will actually be some space configured at the center's east side location on 46th to provide this service as well. So it's our intention.
Barrio is located on East 46th.
El Barrio is located on 52nd and Detroit, but there was a merger essentially of programs with the centers, and so they're a part of that broader network of providers.
Let me allow Councilwoman Brown.
It was on that point. Councilwoman Brown did make a good point, Dave. I stated January, but since we do have budgets coming up, do you think you would have some more information in regards to this, or you could present at budget time since the contract does end on
Absolutely.
December 31st?
Absolutely. I'd be happy to, when I come before you for the budget hearings, I'd be happy to provide an update on where the state is with their implementation.
Thank you.
Councilwoman Brown.
Thank you. My apologies for being tardy today, and some of these questions may have already been addressed. I think you mentioned, Dave, that there are 900 people that this program touches. Is that assessed, served, or placed when you say 900 people?
To the councilman, there's a couple different actions in your question. Mm-hmm. So over the full term of the contract, essentially 850 people were enrolled as participants. More people may have come in and got some additional information and might not have been served, but we referred approximately 850 individuals into the program. And then from there, a certain number drop off. Some are placed into jobs, some are then maintained in a job for 30 days, some see 60 days, some see 90 days. And so, the 900 approximate number is the total number of participants that were referred into the program during the full term of the contract, which was July of 2012 to present.
My next question then leads me, you said in order for them to receive payment, it is a performance-based contract, and part of that is based on a 90-day retention on the job. If a candidate does not successfully maintain that position for 90 days, is there a percentage that El Barrio would receive? Because it seems to me they have made an investment. So how does that work? Is it all or nothing, or a percentage over the course of time?
I'll let Bob Math do the walkthrough in terms of the payment points.
Councilwoman Brown, there are two payment points. There's a number of benchmarks that we measure. For the folks that are referred, the number of people that actually start, those that become job ready, those that are successfully, and there's a measurement tool that we use to say that these folks are job ready now. And then the number of people that are job ready that are placed, and the number of people that are placed that retain their jobs for 90 days. While those are five, measurable points, there are two payment points attached to that. The two payment points are placement, so they get a dollar amount for everybody they place. Then for everybody they retain for 90 days is a payment point. If the person doesn't make it 90 days, it is kind of an all or nothing. They don't get that payment at 90 days. Now if that same person loses their job for whatever that reason, and they continually stay engaged, it's the incentive for El Barrio, of course, is besides their fact they're social service agents, they want to serve all these folks, you know. If somebody loses their job prior to the 90 days, they will still have an opportunity to work with them. You know, we've developed in the contracts something what we call, or what some people would call an employee assistance program. So if we see somebody didn't make it, we expect them to engage that participant, get a sense of what transpired, why did they lose their job, and then they try to mitigate those problems. So we just they don't wash their hands and say, geez, that's too bad. You know, they try to mitigate those problems, and then they work with them, try to engage them back into a job. And if they achieve the 90 days, then they can still get that payment.
Any further questions from the committee? Let's go back to the state again. Dave, are you a part of the group that is helping them craft this?
Yes.
And my question is, I want to get a sense of what the state is trying to accomplish. How do they see an improvement? You mentioned reducing the dependence on public assistance. I always say it from the reverse, help people become self-sufficient.
Yes.
But same thing.
No, I agree. I agree with that. I like your point of view on it.
So help me to better understand what their philosophy is, their goal, and what do we expect to get from this new state comprehensive case management?
Sure. So I first off, Councilman, I agree with you that your question and your point of view is actually important, because when the state initially convened the group and they said, the purpose of this is to reduce dependence on public assistance, the first thing we established with the state is the reduction has already occurred, right? There are 30,000 people, it's a round number again, receiving cash assistance in Ohio that are required to do the work activities. There was a time there were 30,000 people in Cuyahoga County getting cash assistance for that. And so the reductions occurred. And so we really pushed back gently to the state to say, how about our focus is on your focus, which is how about we focus on helping people become self-sufficient? How about we make a commitment to have it take as long as it has to take? And how about we set aside our laser focus on these federal mandates that at times don't make sense? And what I would say about the state's proposal that I agree with is that for too long, much of the focus has been on meeting the federal rates. 50% of our cash recipients are doing some sort of activity. And so long as you got that 50% big check on your report card. And really what our focus should be on is what Armin Budish has been talking about for 6 months straight, job growth and job opportunity. We need the growth to occur to have Cuyahoga County grow. And these individuals need job opportunities. That's Armin's clear focus and his challenge to me, is your programs need to do better at preparing people for employment, to be self-sufficient, and not just in a job that gives them a check that they may be able to continue to receive benefits, on a job that gives them a livable wage, and in a position that links them to benefits, and then ultimately has a career path, somewhere to go with their life. These are young people. These are, majority are less than 24. They got a lifetime of opportunity ahead of them, and our system needs to link them to that. And so that's really what Armin's been talking about all along. And I think on that point, the state agrees with us that our public assistance program does provide certain resources, such as this one, to recipients. And we have to find a better way to leverage those resources, connect them to jobs that are growing, and have it be not just a case activity that helps us meet a rate, but it's something that's very meaningful to the client. And so I think the governor's proposal is to try to have more of our public assistance population become work ready, become engaged in jobs while they're receiving assistance, be linked to all of the open positions in Ohio Means Jobs, and ultimately for us to address their barriers, address whatever's holding back those residents from getting those jobs. And on this point, I feel like Armin Budish's administration has staked out a clear path forward, which is job growth and job opportunity. And so we've been on that since day one. And the governor's proposal on this over the past couple months is in somewhat support of where we're going anyway.
Has the state given you, even in these early stages of the formulation of what they're trying to do, have they given you any substantive changes that they plan to implement, something that either throws up a red flag or is encouraging to this point?
some of the questions that are being asked is if we're going to have this new system in place, what data system will we track clients in? I mean, if we're all focused on outcomes, you have to be collecting your data to be able to validate your outcomes, right? And the data system that will ultimately be used, in my opinion, is not yet configured to provide this service. And that's the data system that was created to transform our caseload from a DOS-based system called CRISI to the Ohio Benefit Worker Portal, which is a Windows-based system. So OBWP is not yet set up to take these cases. And so we're going to have some sort of interim system in there. And we're talking with the state, and the state is certain that they're going to come up with a solution. And I think the solution will be to utilize the system that exists in Ohio Means Jobs. So that's a question that's been asked is, okay, so if you will have expectations that we'll achieve certain outcomes out of this program, and and you're going to maybe tie accountability to that, then what's the system that you're going to use to evaluate us? And how effective is it in documenting our outcomes and our work? So that's an area where we're working through with the state. And I want to be clear, not just the state, but Ohio Means Jobs. When our work with the state began, the state started by simply engaging the JFS directors. And finally, we called time and said, listen, if half of this system is going to be Ohio Means Jobs, then they should be at the table at the same time. Don't meet with us both separately. Bring us all together and let's come up with a solution together. I mean, they're our neighbor. They're in Cuyahoga County. They're a part of the same system. So why not all work together? All really coalesce around this vision of job growth and job opportunity.
Okay. Coming back locally, you mentioned earlier that in the past we've had multiple providers, and now we're looking for that one provider. Were you referring to El Barrio as being this one provider?
So,
what did you mean by that?
So, in the past, different agencies have used this. Even as recently as this year, we had 2 agencies providing us this service. We think we can use just one, and they have enough capacity to serve the entire community, and we don't need to run 2 contracts.
And El Barrio is that one?
And El Barrio is that provider.
What was the other?
L&E and Associates.
Okay. Are they still in existence? Are they?
To my knowledge, they are. There is actually, excuse the term, a tail on their existing contract. So they have a contract that ended last week. And as Bob Math referenced, we will continue to make payments for 90 days if people are maintaining employment. So although their contract has ended, we've kind of allowed for them to continue to receive payments for anyone that's placed through 90 days.
Mm-hmm. I'll say this one thing as a chairman, I'm sensitive to the providers in the sense that how the county chooses to operate in all of our different arenas. And we can fluctuate. There are times when you have multiple providers. There are times when you have one, and that has changed in the winds over the years. But I like to get a sense of why we choose to go from one to the other. Many times one provider can do the job. Many times multiple providers can. I don't think there's a one type fit all approach. But I do like to know why we choose to go, and I'd like to know the impact it has on the industry when we do that. Sometimes smaller companies need support, and we should consider them vulnerable aspects of the community, and it should be factored in when we decide to do what we're going to do. So having prefaced it in that way, give me a sense of what impact this is having and why we are changing from multiple to one provider.
Well, as I said, in years past, we served significantly more people through this program, and the number of people that are receiving cash assistance has really declined significantly. Even as early as just a year or 2 ago, we had 2,500 people receiving cash assistance and that were required to go out and do some sort of work activity. We're now down to 12, 13, 1,400 people. There is simply not the same demand for this service provider. And so maintaining 2 different contracts with all of the administrative costs and maintaining multiple sites is probably less efficient and cost effective. There were some issues related to L&E's contract that were significant, and I'd be happy to review those with you at another time if you'd like to just have a better understanding of them.
Okay. Any further questions? Council?
Through the chair to Mr. Merriman, you spoke about hospitality, or it might have been Mr. Math that spoke about hospitality. El Barrio helps with the hospitality and things of that nature. In line with our county executive, Armand Budish, and assisting young adults obtain employment, has there been any discussion in regards to our new hotel that we're building and getting and working directly with El Barrio and these individuals having a fast track to a job that will be open pretty soon?
You know, I don't know that there's been any discussions about the new hotel that's opening up, but it's a great idea. It's a great idea. So unless Bob's got any input on that, I think it's something that, it's an idea worth really
How
looking
do we start those conversations?
Councilwoman Conwell, El Barrio, they as all our other providers in the past, kind of they have a pulse of the new industries that are coming into town, new providers. I mean, they have relationship with all the large department stores, all the Marriott system and so on. So when new providers come in town, they immediately establish contact with the human resource department to get a sense for what their employment needs are, what kind of candidates they're looking for, and they develop those relationships early on. My guess is they probably already began. I'm sure they've thought about it, if they haven't begun those talks already.
I forget the director's name again. I spoke with her on the phone. I can't remember.
Well, the
her name.
director of
At El Barrio.
director of El Barrio is Ingrid Angel,
Yes.
and then Elizabeth Newman is the president and CEO of the Centers for Families and
Right.
Children.
Okay. Because to me, I mean, it makes sense. And we're talking about putting our own Cuyahoga County residents back to work. We have a new hotel, and that's one of the things that since we're commissioned with only one organization, that we should work towards getting that done. I know you can't steer jobs or say certain individuals are guaranteed a shot, but I think you can work in preparation that they can have a good shot at that.
And I think all of our goal is to not have these large employers hire our clients because they're our clients. We want them to hire them because they're good workers.
Right.
They're our residents, they're our neighbors. And so this is not so much about getting employers to see the need to hire people receiving public assistance, but seeing that a person receiving public assistance is no different than any other applicant if appropriately prepared and ready to work. And so our goal is to have no difference. So the employer looks at that person and has no sense that at some point in their life they needed some public assistance. Our goal is to have that person get that job, but then the next job and 2-3 jobs on it so that they have a full career open before them.
Hospitality leads to a lot of jobs, management jobs. It's a very good start for individuals.
I absolutely agree. I did a tour of across the street at Medical Mutual and was talking to their call center managers, asking about what sort of people do you hire for your call center, and they like a lot of staff that have retail background. And, so people that start out in a retail position, get a retail management position, could ultimately get a job with Medical Mutual. There are career paths out there, and we just need to find them and support them.
Thank you.
Are there any further questions from the committee? If not, I'll make a motion that we move this resolution to the full council under second reading. Actually, we don't need suspension.
No,
Is that
we,
correct?
we do on this one. If we could have this in 2 readings, that would be greatly
2
appreciated.
readings? All right. And we will, under second reading suspension.
Second.
Moved and seconded. All in favor say aye.
Aye.
Ayes have it. All right.
Thank
Thank you.
This goes to what you were just talking about, the pathway to
Right.
get a hotel, get a program, you want to reduce, give them a
Right. Director Merriman, one question. On the workforce participation rate, where are we? If you can tell us off the top of your head, where is the county at this moment? And just for those, just so we all understand, workforce participation rate is the cash assistance that we provide to the residents of this county. Anyone receiving cash assistance, 50% of that pool should be involved in the workforce. They should be participating in some active type of work as a result of receiving cash assistance. And we know the state average is 50%. Where is the county at this moment?
Yeah, if I could just provide a little bit more detail around your statement, which is that, so there are approximately 7,000 people receiving assistance groups that have cash assistance. the vast majority, 50, 200 or so, are families where a family member has accepted children into their home for foster care or guardianship, or a person with a disability has children, and they are not required to do the work, to your point. So those individuals are not counted in our work participation. The remaining 2,500 or so, about 1,000 of them are exempt because they may be pregnant at the time, they may have a short-term disability. So when I say that we have about 1,200 to 1,300 individuals receiving cash assistance that are required to work, those are just the individuals that have children that are not exempt because of a physical disability or pregnancy and are required to do something. So of that population, we are at 50%. The last 2 months, we've achieved the 50% metric. So it's we're, I think, doing well. There have been periods in the year where that number has dropped. There are certain times that we have some challenges with meeting the rate. Much of it has to do with serving young people that are in school that have children. When they're in school, that school counts as their work requirement. When they get to like December or when they get to June, a lot of time their school activity ends. And we have to quickly engage them and get them into some other activity. Otherwise, our rate drops. So the answer to your question is the past 2 months we've been at 50% or above. I'm not exactly sure where we are on the year, but we're hovering around that 50%. But there is some fluctuation in the rate.
And you have factored in, I guess, children, age 16 to...
Right, we don't have many 16-year-olds that are receiving benefits. I mean, they're on the
Right.
cases of their parents. So this is mostly 18 to 24-year-olds.
18, okay. Okay. All right, thank you very much. Is there any miscellaneous business? Chrissy, is anyone else signed in for public comment?
No, Mr. Chair.
All right, well, if nothing else holds our attention, our committee meeting is adjourned.